Most people think it's harmless to hold in their pee during intimacy. In fact, many do it because they don't want to interrupt the mood or feel embarrassed. But here's what no one tells you. It can quietly damage your body in ways you might not even realize. When you hold urine in for too long, especially during sexual activity, you're creating the perfect breeding ground for bacteria. The warmth, moisture, and pressure can push bacteria back into your urinary tract, dramatically increasing your risk of a UTI. And UTI are not just uncomfortable, they can spread to your kidneys if ignored. It also puts unnecessary strain on your bladder muscles. Over time, this can weaken them, making it harder to fully empty your bladder and potentially leading to long-term bladder control issues. During sex, the extra pressure from pelvic contractions makes this risk even greater. And let's not forget nerve sensitivity. Prolonged urine retention can irritate the bladder nerves, reducing sensation and even impacting sexual pleasure over time. What feels like a small sacrifice for the sake of the moment could actually be setting you up for chronic discomfort. Your body's signals are there for a reason. Listen to them. The hidden dangers of holding your urge to pee during sex. Here are 4 main topics on his title. Topic number 1. When you ignore your body's natural urge to pee during sex, you're doing more than just holding it. You're creating an ideal environment for harmful bacteria to thrive. The bladder is meant to store urine only for a certain period, and once it's full, your body is signaling that it's time to flush those waste products and bacteria out. If you override that signal, especially during intimacy when there's extra pressure on the pelvic area, you're increasing the risk of those bacteria multiplying rapidly. During sexual activity, the physical movements and friction can push bacteria from the genital area closer to the urethra, and if you're not urinating soon after, those bacteria can travel up into the bladder. This is why UTI are so common in sexually active individuals, especially women, whose shorter urethras give bacteria an easier path. Men aren't immune either. Bacteria can still invade and cause inflammation or infection. Once bacteria settle in, symptoms can appear within hours. A burning sensation when you pee, an urgent need to urinate, cloudy or strong, smelling urine, and lower abdominal discomfort. If left untreated, the infection can move up to the kidneys, causing fever, back pain, and serious health complications that may require hospitalization. Many people assume a UTI is just an annoyance you can fix with cranberry juice or a couple of days of discomfort. But the truth is, recurrent UTI can scar the urinary tract, weaken the bladder lining, and even increase susceptibility to future infections. For those with weaker immune systems, it can spiral into sepsis, a potentially life-threatening condition. Simply put, avoiding the bathroom for the sake of keeping the mood is not worth the risk. Your partner will understand and your health depends on it. Making a quick trip to relieve yourself can save you from days or even weeks of discomfort and potential long-term damage. Topic number 2. When you hold your urine during sex, you're not just risking an infection. You're putting significant strain on your bladder and pelvic floor muscles. The bladder is a muscular organ, and when it's stretched beyond its comfort zone, those muscles have to work overtime to keep everything contained. During intimacy, the added pressure from movement and arousal can push your bladder even closer to its limit. Over time, repeatedly forcing your bladder to wait can weaken the muscle tone, making it less efficient at emptying fully. This can lead to chronic urinary retention, where even after you finally go, some urine stays trapped inside. That leftover urine becomes a breeding ground for bacteria, setting you up for recurrent urinary tract infections, bladder inflammation, and discomfort that lingers long after sex. The pelvic floor, which supports your bladder, bowel, and reproductive organs, can also suffer. Holding in urine causes tension in these muscles, and when combined with the natural muscle contractions of sex, it can lead to spasms or pain during and after intercourse. Over time, you may notice issues like leaking urine when you laugh, sneeze, or exercise, an early sign of stress incontinence. For people already dealing with pelvic floor dysfunction, the effects can be even worse. The bladder may become overactive, making you feel like you have to urinate constantly, even when it's not full. This can lead to a frustrating cycle of discomfort, reduced sexual pleasure, and anxiety about intimacy. And it's not just physical, there's an emotional impact too. Chronic bladder discomfort or fear of leaking during sex can cause embarrassment, lower self-confidence, and even reduced desire. For couples, this can create tension, avoidance, and misunderstandings in the bedroom. The simple solution: listen to your body. If you feel the urge, take a quick bathroom break before or during sex. This doesn't have to kill the mood. It can actually enhance intimacy, because you're taking care of yourself and preventing pain or complications later. A healthy bladder and relaxed pelvic floor will ultimately make sex more enjoyable, not less. Topic number 3. One of the most underestimated risks of holding your urine during sex is the increased chance of urinary tract infections, UTIs. Your urinary tract is meant to flush bacteria out when you urinate, especially bacteria that might sneak in from the genital area during intimacy. But when you hold it, you're giving those bacteria extra time to multiply in warm, stagnant urine. And once they start multiplying, they can quickly move upward toward the bladder, causing that burning, urgent, and sometimes unbearable sensation that defines a UTI. During sex, physical friction and pressure can actually push bacteria closer to the urethra, especially in women, who have a shorter urethra compared to men. This means that if your bladder is already full, you're providing a perfect breeding ground for bacteria that were introduced during the encounter. For men, the risk is lower but not non-existent, especially if they already have prostate issues that make emptying the bladder fully more difficult. The problem with UTI isn't just the immediate discomfort. If left untreated, bacteria can travel up to the kidneys, causing a more serious infection called pyelonephritis. This can bring severe back pain, fever, chills, and in extreme cases, require hospitalization. Even if you treat it quickly, repeated UTI can lead to bladder scarring, reduced capacity, and long-term irritation. And then there's the fact that UTI don't just affect your body, they affect your relationship. Imagine associating sex with burning pain afterward. Over time, you may start to avoid intimacy altogether just to sidestep the discomfort. This can lead to frustration, miscommunication, and emotional distance between partners. For those prone to recurrent UTI, holding urine even once during sex can trigger a cascade of issues that take weeks to fully recover from. Antibiotics may help, but frequent use of them can lead to resistance, meaning the bacteria become harder to kill over time. That's why prevention is so critical. The best protective step you can take is simple: empty your bladder before sex, and if possible, urinate again afterward to flush out any bacteria that might have been introduced. Combine this with good hygiene and plenty of hydration, and you dramatically lower your risk of infection while protecting your long-term urinary health. Topic 4. Holding your urine during sex isn't just about bladder discomfort or the risk of UTI. It can also set off a chain reaction that affects your pelvic floor health over time. Your pelvic floor muscles are a network of supportive tissues that control bladder function, bowel movements, and even sexual sensation. When you repeatedly resist the urge to urinate, you're forcing these muscles to stay contracted for extended periods, and that can create tension, weakness, or even dysfunction down the road. Think of it like clenching your fist for too long. You eventually lose strength, your hand cramps, and you may not be able to open it comfortably. The same happens with the pelvic floor. Over time, chronic holding can lead to muscle tightness that causes pain during sex, difficulty fully emptying your bladder, or even incontinence later in life. For women, this may also contribute to pelvic organ prolapse, where the bladder or uterus begins to drop into the vaginal space. For men, weakened pelvic floor muscles can reduce erectile firmness and staying power. There's also the nerve factor. Your bladder is connected to a network of nerves that communicate with your brain, telling it when it's time to go. Ignoring these signals repeatedly can confuse your body's natural feedback system, dulling your ability to sense urgency until the bladder is dangerously full. In rare cases, extreme overdistension can even damage the bladder muscle permanently, reducing its ability to contract and empty efficiently. From a sexual health perspective, a tense or fatigued pelvic floor can blunt sensation and reduce pleasure. You might find that your orgasms feel less intense, or that reaching climax takes longer and feels more effortful. This is because healthy pelvic floor contractions play a direct role in sexual release for both men and women. Preventing this chain of events doesn't require complicated changes, just mindful habits. Listen to your body's cues. If you feel the urge to pee before sex, take the extra minute to relieve yourself. If the urge comes during sex, consider a quick bathroom break rather than pushing through discomfort. Not only will this protect your urinary health, but it will also preserve pelvic muscle function and keep your sexual experiences comfortable and pleasurable for years to come. In the end, honoring your body's signals isn't just about preventing a single problem. It's about safeguarding a complex system that supports your health, confidence, and intimacy for the long haul. When it comes to intimacy, we often focus on the emotional and physical connection, but forget that our bodies have their own quiet language, signals meant to protect us. Ignoring the urge to urinate during sex might seem harmless in the moment, yet it can slowly chip away at your bladder health, pelvic floor strength, and even the quality of your sexual experiences. By listening to your body, you're not breaking the mood. You're preserving the foundation for many more years of healthy, satisfying intimacy. Respect your body's cues, and it will reward you with pleasure, confidence, and lasting vitality in the bedroom and beyond.